Hello, I'm Jon Salmanton-García, postdoctoral researcher in the Institute of Translational Research in the University of Cologne in Germany, and today I would like to share our last publication on specialist training in infectious diseases in Europe. These are my conflicts of interest, which are not related to the topic I'm sharing with you today. And first of all, it's necessary to start with slight or little brush of background. As you all may know, infectious diseases represent a significant threat to global public health, and therefore medical specialization and harmonization of training are key to improving the healthcare response to these threats. The COVID-19 pandemic highlighted the importance of cross-border collaboration precisely on infectious diseases care. And this work, it's part of an initiative from the UEMS, the European Union of Medical Specialties, or the Union Européenne des Médecins Spécialistes, and since 1987 has promoted precisely this standardization of infectious diseases training. Initially, as we all can remember from our history lessons, infectious diseases practice was based in isolation hospitals. And we can see a very good example in the picture in the upper part, where we can see one hospital, and basically in front of it has the beach. It's located in Gorliz in the north of Spain, in the Basque Country, which basically means that it's at the end of the country. Afterwards, it comes a forest, and then we do have the first village. However, today, these infectious diseases practices and clinics are integrated within clinical microbiology, public health, and other services. And they are actually, in some cases, also located within the cities. In the screenshot I took from Google Maps, we can see how it's located, the University Hospital of Cologne, even if we see some green areas, but basically the hospital is located in a residential area within the city. In 2018, the European Training Requirement, ETR, in infectious diseases was expanded, and actually coming from there in 2021, we performed already one analysis on how was or how were the curriculums to become infectious diseases physician in the different European countries. With the pass on of the pandemic, we decided to run again this study, this survey, to check how things would have changed after the COVID-19. The survey was conducted between November 2023 and March 2024 in 35 European countries belonging to the infectious diseases section with representatives in the UEMS. In the picture, you can see the distribution of countries. And there was an assessment done based on the training instructor, assessment methods, and also the training capacity. And here we have a map with the different status of the specialties. In the 70% of the countries, 27 out of 35 countries recognize infectious diseases as an independent specialty. 7 countries out of 35, so the 20%, recognize it as a subspecialty. And there was one country, Spain, where none of them happened. Basically, Spain was the only country in this study where infectious diseases is not recognized neither as a specialty or a subspecialty. The median duration of the training is 5 years, and as one could guess, the training length depends on whether in one country the infectious diseases is a specialty or a subspecialty. The longer it is, it's associated to specialty, the shorter to subspecialty, and the overall range can go between 2 and 7 years. The training in internal medicine is present in all the curriculums. However, the training in medical microbiology only in half of them. From the 2021 analysis to the current one, 2 main changes. In Austria and Norway, infectious diseases has been, so to say, promoted from subspecialty to full specialty. And we have 3 interesting or 3 special cases: Iceland, Luxembourg, and Cyprus. In these 3 countries, it's not possible to perform the training within the borders. So the trainees have to go to third countries. In the case of Iceland, normally it's United States or other Nordic countries. In the case of Luxembourg, mainly Belgium or France. And in the case of Cyprus, the preference is Greece, as there is one agreement between the governments of both countries. Regarding other ID specialties, we have tropical medicine, which is recognized as a full specialty in 3 countries out of the 35, so 9% of the countries, and pediatric infectious diseases in 6 countries out of 35, so 17% of the countries. And moving forward, training and research capacity. Almost 90% of the countries include formal resident evaluation mechanisms, which can be oral, written, or practical, or a combination of 2 or the 3 of the options I mentioned. 77% do promote research. However, and this is very important, only 45% of the countries allow this research exclusive or they do provide exclusive time for this research. There are higher training capacities in Nordic and Baltic countries, more training hospitals per million inhabitants in Estonia, Norway, and Latvia. And regarding the number of infectious diseases specialists per million inhabitants, we have the highest number in Sweden with almost 80 specialties per million inhabitants, and the lowest in Luxembourg with 6 specialists per million inhabitants. So with this, we come to the ongoing challenges, and here we have an interesting list. The first of all is that the disparities in infectious diseases training and assessment persist, unfortunately, across Europe. COVID-19 has actually, unfortunately, increased the number of specialists in some countries. However, not every country can say the same. Spain does not recognize still infectious diseases as either specialty or subspecialty, and the training in microbiology and tropical disease or tropical medicine still needs some or quite some improvement. Harmonization, as we mentioned at the beginning, is key for the training, especially focus on the pandemic and antimicrobial resistant response. Better access is necessary, strictly necessary for training, research, and supervision. And finally, collaboration between countries and organizations is crucial for quality training. Finally, I would like to thank all the country representatives for having provided their data from the respective countries, also to the European Union of Medical Specialties, more specifically the infectious diseases section, also the Trainee Association of the European Society of Clinical Microbiology and Infectious Diseases, and to Professor Oliver Corneli for having supported this research. If you scan the QR code, you can access the full publication. Thank you very much and see you next time.